About half of Australians and New Zealanders diagnosed with cancer each year may benefit from radiation therapy. It's an important part of breast cancer treatment for some patients. But what is radiation therapy and who is it best suited for? To answer this, we sat down with Professor Julia White. She's a tenured professor of radiation oncology and Colt Sisters Chair for Cancer Research at The Ohio State University. She was also an international guest speaker at this year's Breast Cancer Trials annual scientific meeting.
So radiation is the use of X-rays or electrons to deliver a dose of treatment to a cancer, and doing it in a way that spares as much as possible the surrounding normal tissue around the cancer. So ideally we want to kill the cancer with the radiation and spare the normal healthy tissue, so that patients overall do well in terms of not having cancer recurrence, but also not having long-term consequences of having radiation therapy.
So how is it used specifically in breast cancer treatment?
So in breast cancer treatment, it's used for every stage of breast cancer. In early stage breast cancer, the main focus of radiation is to help women keep their breasts. We know the addition of radiation following a breast-conserving surgery, or a lumpectomy is the term I typically use, is really what makes the treatment equivalent to having had the breast removed or with mastectomy. In more locally advanced breast cancer, when the cancer has spread to the lymph nodes, it's a barometer or a sign, if you will, that cancer is more at risk for spreading to the bloodstream and causing distant metastases, or really what makes breast cancer life-threatening. And so in node-positive, axillary node, armpit node-positive breast cancer, we're able to use radiation to treat the lymph nodes and reduce the chance that cancer will spread through distant metastases. And then the last way we use radiation is when breast cancer is incurable, it's metastatic, and patients and women are having pain, or it's disrupting their lives with function problems because of pain. Radiation can be used to help reduce the symptoms, improve quality of life in women with metastatic breast cancer.
So how does it exactly work? How is it given?
So radiation is delivered. To make radiation safe, we have to divide the dose of radiation we want to give into many doses that was delivered Monday through Friday, 5 days per week. And that allows the normal tissue surrounding the cancer to heal appropriately. So most radiation get delivered for breast-conserving therapy to help women keep their breasts if they have early stage breast cancer, is done in about 3 to 4 weeks' time, Monday through Friday. So typically somewhere between 15 and 21 treatments is what's used regularly. Now that varies a bit around the world. When we treat the lymph nodes, I think there's some ongoing debate about how many treatments you should receive. But typically that too is between 15 to 25 treatments, Monday through Friday, 5 days per week. So for women, between 3 to 5 weeks of radiation. Now, having said that, that sounds miserable, right? 5 weeks of radiation. You're in the radiation center for about an hour a day at most. And you're on the radiation treatment table on average about 20 minutes. The on time of the actual radiation machine is only several minutes, between 8 and 12 minutes typically. And you won't feel anything, you won't see anything. You hear the machine kind of click on and whine and click off during the treatment.
So obviously it doesn't hurt when you're receiving it, but are there any common side effects of radiation therapy, and how can they be subsided?
So really, nearly every patient who goes through radiation therapy, either for breast conservation or because her lymph nodes have cancer cells in them, nearly, I have to be honest, 100% by the end of radiation have symptoms from the radiation. The skin is what takes the brunt of the radiation side effects. By the end of radiation, I think it's nearly 100%, if not exactly 100%, will have some skin discoloration, usually redness of the skin or tanning. The skin darkens. And that can be really managed regularly with early intervention with moisturizers and emollients and anti-itch creams to help keep patients safe. And in my own practice, we follow this closely, and up to 90% of women, through the combinations of topical agents and over-the-counter medicines available through the regular pharmacy, usually can keep comfortable about 90% of women. Only about 10% do we have to give a prescription medicine to help with discomfort.
All right, and so what clinical trials or research into radiation therapy are currently available or are being investigated?
So I think I think the goal of radiation oncology trials in breast cancer right now is to figure out what radiation therapy strategy fits the cancer and the patients individually. So we know that there's now that we understand so much more about the biology of breast cancer, we think we can identify women who can have successful breast conservation with just having surgery. You don't need to have the radiation. Now, that won't be everyone, but there is a subset of patients out there, and I think that we finally are at a point understanding the biology of breast cancer and now using subtypes that, for instance, luminal breast cancers, which are characterized by being hormone sensitive, and particularly women who are dedicated to taking their endocrine treatment, we can identify biologically some that can be done with breast conservation after surgery, and that'd be awesome. Now, we also know that the other way that we can help that is just to reduce the number of treatments. So now there's partial breast irradiation, which can be done somewhere between 1 week or so, somewhere between 5 and 8 days of radiation. And that reduces the burden of treatment. While maybe not getting rid of it completely, helps reduce the burden of treatment. And then I think the other important thing is for us to remember there are women with higher risk breast cancer, and how can we improve their cures? And that's where figuring out who really needs nodal radiation, regional nodal radiation, and also now with all of, when women have newly metastatic breast cancer with just a few metastases, we're asking ourselves in research questions, should we really be doing very high dose specific radiation to those cancer sites to see if we can improve survival there? So what's characterized, I think, all our clinical trials are trying to fit whatever the stage of cancer is and the needs of the patient, trying to make sure we have a strategy for radiation that is either means backing off a little bit or enhancing, intensifying a little bit. Figuring that out, I think, is where the goal of our radiation is right now.
That was Julia White, Professor of Radiation Oncology at The Ohio State University. If you'd like to learn more about breast cancer trials or you'd like to support our life-saving research, follow us on social media or visit our website at breastcancertrials.org.au.